This is Dr. Daniel Paul, orthopedic doc with Easy Orthopedics, and today we're going to talk about what a PA is and are they qualified to treat your injury, which can be a very hot topic in the world of medicine. If you like this video, we put out new content weekly, so please like and subscribe. So the short answer is they can be. So PAs can be very good. You know, doctors can be very good. PAs can also be not so great. Doctors can also be not so great. So when you're a doctor and you come out, not after 4 years of medical school, you got to go through something called residency, where they just pound you into the ground for like 4 or 5 years. For me, it was 5 years. And when you get out of that process, just from working 80 hours a week and just constantly immersed in that educational environment, you have a good understanding even from day one. Now, when you have a PA, which is physician assistant, and they usually need a supervising physician, they don't necessarily have that when they come out. So if they're right out of the chute, I think the care is most likely going to be inferior to a doctor who's right out of the chute, not based on the person, but just based on the time spent training, right? All their things being equal. But so if you have a PA but they've been doing it for a long time, and let's say, because I'm an orthopedic doc, they've been working specifically in the world of orthopedics for a long time, they can be just as skilled as anybody else. Because they have those hours and they have that experience, they spend time in the OR, and they can be good. Just as good as anyone else. But again, that's for specifically an orthopedic PA, and that's for one that's been working for a while. Now, if you're going for a PA for a musculoskeletal injury and they're not an orthopedic PA and they haven't been working for that long, then I think this treatment you're going to get is going to be substandard. Same thing with a primary care doctor as well, depending on what the injury is. Again, it all comes down to experience. An experienced PA can be great. An unexperienced PA, but if they have a doctor backing them up and they talk to them regularly, can also be good. But if they're not really doing that and they're kind of on their own, you see more of that with NPs, then I think it can be questionable. But again, it's just a matter of experience and time spent, treating patients. So I hope I was able to answer your questions about a PA and when to see them and maybe when to go to a doc. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific medical advice because this video and all my videos are for educational purposes only. Thanks for watching.